By far, the most common question I receive from dentists regarding CT scans is, can a vertical root fracture be detected on a CT scan? The easy answer to this question is yes and no. Some fractures, such as the one present on one of these teeth, is not visible on a conventional film. However, when we look at the CT scan, things become much more apparent. If we look at the axial image on the upper right side, we can see right away that the vertical root fracture is coming from tooth number 4. And as we progress up the root, we can see the fracture from the lingual extending out towards the facial at the apex. The image on the lower right, which is the coronal image, also gives you another view of the root fracture. This patient presented for evaluation of biting discomfort in the lower right quadrant. I checked teeth number 30 and 31 and found that tooth number 31 had a normal response to percussion, bite, and the application of cold. Tooth number 30 had a slight response to biting, but was normal to percussion. The conventional film did not reveal apical pathology or vertical root fracture. So now if we take a look at the CT scan and we start at the axial image in the upper right quadrant, we can see that there is bone loss adjacent to the mesiobuccal root. And as we go up and down that mesiobuccal root, we could see that bone loss extending to the end of the root. However, apically, there's no large pathology present. So it's literally lateral to the mesiobuccal root. Then if we look down here in the lower left, we can see another view of the bone loss. And then at the skeletal reconstruction in the upper left, we can also see the bone loss adjacent to the root. Probings were 9 millimeters adjacent to the mesiobuccal root, and everywhere else was 3 millimeters. So this is diagnosed as a vertical root fracture, and this tooth will need to be extracted. Teeth with vertical root fractures which do not extend completely down the root can be more difficult to detect. Let's look at this image. This patient was referred for treatment of tooth number 19. As expected, the tooth tested non-vital to the application of cold. You can visualize the apical pathology here. Now let's review the CT scan. When this type of incipient vertical root fracture is present, the axial image will reveal a narrow area of vertical bone loss adjacent to the root fracture. In these cases, we are not visualizing the actual vertical root fracture, but instead the bone loss adjacent to the root fracture. Then, if you look at the sagittal image on the lower right, you can see the bone loss on the distal. The 3D skull reconstruction will also show you a good view of the bone loss around the root. Once the fracture is located on the CT scan, it should be fairly easy to find it clinically. These teeth are typically referred for extraction unless the pocket is not of recent duration and the patient elects to retain the tooth given its uncertain prognosis. Well, that's it for this video. The next video will review injection techniques based on an anatomy review from the CT scan.